Ankle joint is divisible into two components. The between the lower end of tibia and the talus, talocrural joint. Second part is the between the talus and calcaneus, which is the subtalar joint. So two components of the ankle joint. Number one is the talocrural between the inferior end of the tibia and the lower end of the fibula and the talus. Second is subtalar joint, which is the between the talus and calcaneus. At talocrural joint, two movements occur on transverse axis and the which is the dorsiflexion and plantar flexion. Whereas in subtalar joint, the two movements occur, which is on the epi-axis, and that is inversion and eversion. So four movements on the ankle joint which occur, two on the talocrural, two on the subtalar joint. So there are two parts of the ankle joint. First part to discuss is the talocrural joint. Now, talocrural joint is maintained by the various ligaments on the medial side. On medial side, there is a ligament which connects the medial malleolus with the various bones. Number one is the posterior tibio-talar joint ligament. Actually, that is maintained by this whole is the deltoid complex or deltoid ligament, which has two parts, superficial and deep. The deltoid ligament, very strong ligament, and that maintain the stability to this joint or connect the medial malleolus with the other bones. First is the superficial part of deltoid ligament, which are three parts: posterior tibio-talar, which connect the tibia with the posterior tubercle or medial posterior process of the talus, its medial tubercle, to which it is attached, the tibio-talar. Second part is the tibiocalcaneal, which is continue to whole of the sustentaculum tali on medial side of the calcaneus projection, connect the medial malleolus with this whole is the sustentaculum tali. Then is the anterior part which connect the with the navicular bone. This one is the navicular bone and it connect with this. So name is given tibio-navicular part. So anterior part connect with the navicular bone, middle part connect with the calcaneus sustentaculum tali, posterior connect with the posterior process of the talus, its medial tubercle. Posterior process has two tubercles, medial and lateral, and that is very strong ligament. D part underneath it, and that is strongly bind the inner surface of the medial malleolus with the rough surface on the lateral medial side of the talus. Next. Now on lateral side, this is the lateral malleolus or lower end of fibula. It is connected by same three ligaments. The posterior, that is the talofibular ligament. This one is the posterior talofibular ligament, which connect the posterior border of the lower end of the fibula with the talus lateral process. This is the posterior process, lateral tubercle of the posterior process of the talus. This small ligament, calcanea, calcanea fibular, that is the posterior talofibular ligament between the talus and fibula. Second is the calcanea fibular ligament, which tip of the lateral malleolus to the calcaneus. This is a very important ligament maintaining the stability of the this joint, ankle joint, and as well as the lower lateral malleolus. This name is given calcaneofibular ligament. Anteriorly, it connects the that is the talofibular ligament talus. This is the talus bone, and to its lateral side neck to which it is attached. Continue from the interior border of the lower end of the fibula to the neck of the talus. The name is given anterior talofibular ligament. Another ligament which connects the medial malleolus with the lateral malleolus. This one is the anterior tibiofibular ligament. This one, anterior tibiofibular. So make it socket deep between the two malleoli. Anterior area is covered by, or make the. Similarly, the medial malleolus and the lateral malleolus connected by a transverse ligament. Name is given posterior tibiofibular ligament. So it make a socket around the talus, so deepen it and provide the stability. This is the posterior tibiofibular ligament connecting the medial malleolus with the lateral malleolus. This again is shown the calcaneofibular ligament in this view. This is the tibiocalcaneal ligament from the tip of the medial malleolus to sustentaculum tali, that is shown. This is the posterior talofibular ligament connect the that is the medial malleolus with the posterior process of the talus. This one is the make it more deeper. Posterior tibiofibular ligament, this one, that is the shown in this view. Ankle joint is the hinge joint. Hinge joint approximately uniaxial joint. It is the uniaxial joint in which hinge joint is a type in which the geometry of the articular surface is such that only to and fro movement occur. So here the two movements occur on this joint is the uh, dorsiflexion and plantar flexion. So uniaxial joint, talocrural. Similarly, separate axis for the subtalar joint. So total joint is biaxial, but this talocrural obviously is uniaxial on transverse axis. Passes from the tip of one malleolus to the tip of the other malleolus, uniaxial, traversing through the talus. It is hinge type joint. Lower end of the tibia and its medial malleolus with the lateral malleolus of fibula and inferior transverse tibiofibular ligament that make total boundary line. Lower end of tibia and its medial malleolus on one side medially. Lower end of tibia is above the talus, medial malleolus on the medial side of talus with lateral malleolus of fibula and inferior transverse tibiofibular ligament form a deep recess or cup-like structure for the body of talus or accommodate the talus. Normal range of dorsiflexion. Now one should keep it in mind that the superior surface or the trochlear surface of the talus wider anteriorly, narrow posteriorly. So if one try to move the foot up, then anterior wider surface is obstructed between the two malleoli. Two malleoli, they never separate apart from each other, so they does not accommodate anterior wider part of the talus, so it is limited movement. So this limitation is that normal range of dorsiflexion is 10 degree. What we mean by dorsiflexion is a movement in which the dorsal surface of the foot and ventral surface of the leg, that is angle between the dorsum of the foot and front of leg, is reduced. Say 91% is standing straight, the angle between the dorsum of foot and front of leg is 90 degree. If this angle is reduced by, say, by the upward movement of the foot 10 degree, which means this angle become 80 degree, or when the knee is straight, when we are standing straight, it is become the 10 degree reduce. So reduction in the angle, normal 90 between the front of leg and dorsum of foot. If foot is raised, how much raised? That is 10 degree is raised, angle become 80 degree. So this limitation is due to broad anterior part of the talus, which is failed to separate two malleoli from each other and accommodated and limit the movement. Or 30 degree when the knee is flexed. So when knee is flexed, then surrounding muscle become relaxed and they permit it even up to 30 degree dorsiflexion. Dorsiflexion is under control of deep peroneal nerve. If that is paralyzed or damaged, dorsiflexion failed to occur, condition known as foot drop. So this is the normal range of dorsiflexion 10 degree, foot is straight when standing. If one is sitting position, if you do the dorsiflexion, it becomes 30 degree. Normal plantar flexion is the movement in which angle between the dorsum of the foot and front of leg is increased, which means it is 90 degree. And say if we say that normal plantar flexion is 30 degree, which means it become 120 degree, 90 plus 30, 120 degree. That is the plantar flexion. Angle between front of leg and the dorsum of foot is increased by 30 degree, so that sole faces backward. Dorsiflexion result in joint adopting the close back position with the maximum congruence and ligamentum tension. So articular surfaces are fully congruent in dorsiflexion movement and they become point to point fit with each other. So name is given close back position. Malleoli grip the talus and no lateral movement occur without stretch of inferior tibiofibular syndesmosis. The lower end of the fibula attached to the tibia, not the malleolus, but just above that, the shaft of the fibula is in contact with the lower end of tibia, where a strong ligament is present and forming the syndesmosis that is failed to separate lateral malleolus from the tibia. So tibia is very strongly, fibula is very strongly attached to the tibia. Medial malleolus is a part of tibia. So two malleoli are difficult to separate from each other. So lateral movement, no lateral movement occur. Articular surfaces, when next is the to be considered when you are discussing any joint. Articular surfaces are covered with hyaline cartilage. Hyaline cartilage previously told you that protect the erosion of the bones, and soundless joint, painless joint is the criteria of the hyaline cartilage. It has a nervous, a vascular part. Deeply it is as blood vessel supply and the nerve supply. But superficial part of the cartilage has no blood supply, nerve supply. Easy spread of synovial fluid occur on the hyaline cartilage. So easy mobility. Soundless joint, painless joint is the provided by the hyaline cartilage. That is covered with inferior surface of tibia and the superior surface of the body of talus covered with hyaline cartilage. Talar articular surface which is convex sagittally, anteroposteriorly and concave transversely is wider anteriorly, narrow posteriorly. Talar articular surface for median malleolus is a proximal area on the medial talar surface, comma shape. It is comma shape if you look upon the medial surface of median malleolus, lateral surface of median malleolus. If you look, that is the comma shape, which fit on the comma shape same surface on the medial side of talus. Large lateral articular surface on talus is triangular and vertically concave that articulate with inferior transverse tibiofibular ligament. Bones are held together by fibrous capsule by the medial or deltoid ligament and anterior posterior talofibular or calcaneofibular ligament. Medial side पे one thing which bound or provide the strength to these surfaces is fibrous capsule. Medial side it is deltoid ligament. Anterior and posterior lateral side there is anterior and posterior talofibular between the talus and the fibula, between the calcaneus and fibula, that is the on the lateral side. Fibrous capsule around the joint is thin in front and behind. It is attached proximally to borders of the tibia and malleoli articular surfaces and distally to the talus. Below it is attached to talus. Proximally or above attached to the border of anterior border and posterior border of the tibia and as well as the anterior malleoli and distally to talus near the margin of its trochlear surface except anteriorly where it reaches the dorsum of the talar neck. Its posterior part consists mainly of transverse fibers. Deltoid ligament, very strong ligament, provide the major stability to this joint. Medial collateral ligament deltoid is strong triangular band attached to the apex of anterior and posterior border of the medial malleolus of it is superficial fibers or superficial and deep part. Superficial has three components: anterior tibio-navicular, name indicate extending from anterior border of the medial malleolus to the navicular bone, pass anterior to the navicular tuberosity. Intermediate parts as name given tibiocalcaneal fiber descend almost vertically the entire length of sustentaculum tali from the inferior border and tip of the median malleolus. It passes vertically to entire length of the sustentaculum tali, a projection on the medial side of calcaneus. Name is given sustentaculum tali. Posterior superficial posterior tibio-talar fibers pass posterolaterally to the medial side of the talus and its medial tubercle from the posterior border of the tibia, medial malleolus of the tibia, and that pass to the medial tubercle of talus. Of its D fibers, anterior tibio-talar fiber pass from medial malleolus to non-articular part of medial talar surface or neck of the talus. Intermediate fiber pass deep to the tibiocalcaneal ligament, which is the superficial. It pass deep to that, descend almost vertically to entire length of sustentaculum tali. Deep posterior tibiofutalar fiber pass posterolaterally to medial side of talus and its medial tubercle. Lateral collateral ligament. Ligament has three discrete parts. Anterior talofibular ligament extend anteromedially from the anterior margin of its lateral malleolus to the talus, attach anterior to its lateral articular facet. Posterior talofibular ligament run almost horizontally from the distal part of lateral malleolar fossa to the lateral tubercle of the posterior talar process. The calcaneofibular ligament, a long cord, runs from the depression or malleolar fossa anterior to the apex of lateral malleolus to a tubercle. Joint is lined by synovial membrane which project into inferior tibiofibular joint. Vascular supply and lymphatic drainage. Ankle joint supplied by malleolar branches of anterior, posterior, tibial and fibular arteries. Lymphatic drainage is via the small, long and small saphenous veins along with the superficially. Ankle joint is innervated by deep fibular, saphenous, sural and tibial nerve. Factor maintains stability mainly by the medial and lateral ligament complexes, tendon crossing the joint, bone contours, shape of the bones, capsule attachment. Stability requires the continuous action of soleus assisted by gastrocnemius or tendoaceous which form also provide the stability to the joint. Muscle producing two movements occur at the ankle joint or talocrural joint. Dorsiflexion is the movement in which angle between dorsum of foot and front of leg is reduced by 10 degree and the sole faces laterally when the knee extended and 30 degree when knee extended and knee flexed when the knee flexed. Dorsiflexion is produced by muscles tibialis anterior assisted by extensor digitorum longus, annulusis longus and fibulus tertius. Plantar flexion is the movement in which angle between dorsum of foot and front of leg is increased by 10 to 20 degree and sole faces medially. Plantar flexion is produced by gastrocnemius, soleus, assisted by plantaris, tibialis posterior, flexor lucis longus, and flexor digitorum longus. This is the lower end of the tibia shown. This is the anterior border of the lower end of tibia where capsule is attached. Here is the medial malleolus is shown. This one is the inferior surface of the talus which fit on the body of talus. This is the lateral surface of medial malleolus shown and showing the comma shape surface. Comma shape, the shape of the surface which fit on the comma shape on the medial side of talus. This is the lower end of tibia and the comma shaped surface is shown on the medial malleolus. This is the inferior surface or trochlear surface of the tibia. This is the lateral surface of talus. What is shown is triangular and this triangle fit with the lower end of fibula which is also triangular. It is concave above downward and triangular. Superior surface of the body of the talus is shown which is the broader anteriorly this one and narrow posteriorly. So during dorsiflexion broader part between the two malleoli is obstructed and does not allow further dorsiflexion. This one is the neck of the talus and head of the talus. This is the lateral side of the talus. This is the body of the talus. This one is the medial side of the talus shown the comma-shaped surface. Medial side has two components, this articular surface and non-articular. Here is the deep part of deltoid ligament is attached. This is the comma-shaped, typically comma-shaped surface, medial side of the talus. This is the neck and this is the head of the talus. This one is shown the inferior surface of talus. Inferior surface of talus and superior surface of calcaneus. This both form a joint, name is given subtalar joint. There are three articular facets on it, anterior, middle and posterior facet. Similarly on the tibia, calcaneus, posterior articular facet, middle and anterior articular facet. Between the posterior on one side posteriorly, anterior and middle anteriorly, there is a sulcus which is shown known as, this one is the known name is given, the sulcus tali. Similarly, a long passage is present between posterior calcaneal surface, anterior and middle. This one is the sulcus calcaneal. Both when combined with each other they form sinus tarsi. When we put the talus on the tibia, this this sulcus and this sulcus together form a tunnel-like structure which is the sinus tarsi. The tarsal joints are the talocalcaneal joint. Another name is given the subtalar joint. Subtalar joint is second component of the ankle joint. Anterior and posterior articulations between the calcaneus and talus form the functional unit termed the talocalcaneal or subtalar joint. Posterior articulation is referred to as talocalcaneal joint and anterior articulation is regarded as part of talocalcaneo-navicular joint. Talocalcaneal joint or subtalar joint is a modified multi-axial joint. Its permitted movement are considered together with those at other tarsal joint. Bones are connected by a fibrous capsule by the lateral, medial, interosseous, talocalcaneal and cervical ligament. These are the various ligaments. Articular surface subtalar joint proper involve the concave posterior calcaneal facet on the posterior part of the inferior surface of talus as shown, that is the posterior surface, posterior articular surface, and convex posterior facet on the superficial surface of calcaneus. The fibrous capsule envelops the joint. Its fibers are short and attached to its articular margins. Ligaments of the talocalcaneal joint are the lateral, medial, and interosseous talocalcaneal ligament and cervical ligaments. Lateral talocalcaneal ligament. The lateral talocalcaneal ligament is short, flat fasciculus that descends from the lateral process of talus to the lateral calcaneal surface. Medial talocalcaneal ligament. Medial talocalcaneal ligament connects the medial tubercle of talus to the posterior aspect of the sustentaculum tali and adjacent medial surface of calcaneus. Interosseous talocalcaneal ligament is broad, flat, bilaminar transverse band in tarsal sinus. It descends obliquely laterally from the sulcus tali to calcaneal sulcus. In the sulcus it is present. Posterior talocalcaneal ligament attached to the plantar border of the posterior process. Cervical ligament is just lateral to the tarsal sinus attached to the superficial calcaneal surface. Talocalcaneal joint is innervated by the branches of the tibial, medial plantar and sural nerves. Movement at the subtalar joint, inversion and eversion. It is a movement in which lateral border is on the ground, medial border is off the ground above, and sole faces medially. That is inversion by definition. Heel inversion is controlled by tibialis anterior and tibialis posterior, gastrocnemius, soleus, and extrinsic factor of toe also contribute. Second movement is eversion. It is a movement in which medial border is on the ground, lateral border is off the ground, sole faces laterally. Eversion of the foot results from pull of the fibulus longus, brevis, and tertius muscle.